Hi, welcome to Health Arena with Pharmacology. And on this channel today, I'll be discussing breast milk discharge without breastfeeding, causes, and the remedy. I was in my office yesterday when I met this young lady, and one of the complaints she had was that she was actually bringing out milk from her breast even without giving birth. And so she said she had tried everything she could, but still not stopping, and so hence the reason why she came to the hospital to see the doctor. And so this is one of the reasons I've actually decided to do this video, because we found so many women in our shoes. So we'll be looking at the causes and remedy of breast milk discharge without breastfeeding. So normally breast milk discharge is known as galactorrhea. This occur when there is milky nipple discharge unrelated to normal milk produced during breastfeeding. Now, I want you to note the word milky discharge. Now, note that this discharge is always milky, and so it is not related to the normal breast milk. When I mean not related to normal produced during breastfeeding, is that that individual definitely might not be breastfeeding at the moment, or might not even have given birth, and so definitely can begin to experience this breast milk discharge. Also know that the discharge has to be milky, because some people do complain that, oh, I saw this yellowish, I saw this pinkish, I saw this brownish discharge from my milk. Now this is different from the discharge being milky that occurs in galactorrhea. If you see yourself not bringing out pinkish, yellowish, or bloodish the milky discharge from your nipple, then you should know that there's something serious happening. And so this can be one of the symptoms of breast cancer, and so you need to go and see your medical practitioner as soon as possible, so that the appropriate thing can be done to resolve it. Now, mostly it occurs in women, even those who haven't had children. Like I said, the example of the one I gave, she had never given birth. And even some women, even after menopause, can experience this also. Now, this can also occur in men and even infants. Now, I've seen some men coming down with breasts like women. Their breasts are so big, and so they too can experience milk discharge. And this can occur as a result of deficiency in testosterone hormone, which is an hormone that is being found in men. When there's deficiency in their hormone, it can occur in breast enlargement for them, and also breast tenderness. And so that's when you see them bringing out milk from their breast. Also in infants and newborns, all these ones you can experience nipple discharge, milk discharge from the breast. In newborn, it occurs as a result of the high maternal estrogen level, which crosses the placenta into the baby's blood. And so this will definitely resolve after some days. If it doesn't resolve, then you should know something is wrong. Now, what are the causes of breast milk discharge without breastfeeding? We have medications such as sedatives, antidepressants, hypertensive drugs, antipsychotics. These are the things that can actually cause people coming down with breast milk, women coming down with breast milk from their nipple. Then we have opioid use. Some people are involved in the use of opioids such as cocaine, marijuana, heroin, tramadol, and the likes. All this can actually result in the nipple bringing out milk secretion without breastfeeding. Also, we have people that use herbal supplements. Herbal supplements can also cause it. Then we have birth control pills. There are women that are on family planning pills, because of hormonal changes they can bring about hormonal changes in the system. And so when this happens, it can result in the nipple bringing out milk. Also, tumors in the pituitary gland known as prolactinomia can cause it. Now, when there is prolactinomia in the pituitary gland, it can result in the secretion of prolactin hormone, which would definitely, and prolactin is the hormone that is responsible for the secretion of breast milk after delivery. And so when there is high level of the prolactin in the system, it can actually result in the secretion of breast milk from the nipple. Then we have hypothyroidism, which occurs as a result of the low thyroid hormone in the system. So when there's low thyroid hormone in the system, it makes the thyroid under active, and so when this occur, it can actually result in milk secretion from the nipple. Also, we have chronic kidney disease for individuals that are on chronic disease like kidney failure and the likes. They can actually result in milk secretion. Then we have excessive breast stimulation. Now, when there is excessive breast stimulation, maybe during sexual activities, when the nipple is overtouched, is hypertouched, it can actually result in milk secretion. Then also during, maybe you are the type that do touch your breasts during self-examination, you touch your nipple and you begin to press and press, it can actually result in a milk stimulation. Also, for people, individuals that wear tight fitted clothes and bras, all this can result in milk secretion from the nipple. Then we have spinal cord injury. We have stress can definitely can result in increased level of hormone in the body, and so when this occurs, can actually result in breast milk stimulation from the breast. What are the remedies to this? How can you resolve this issue? Now, the first is to avoid overstimulation of the nipple. Like I said, when you know the underlying causes of an issue, then definitely solution to it is just you trying to get rid of the causes. Now, since you know that, okay, overstimulation of the nipple can actually result in milk discharge, the best thing is to what? Avoid that. So you avoid overstimulation of the nipple during sexual activities. Don't press the nipple too much during breast examination. Also, avoid wearing of tight clothing and bras. When you wear tight clothing and bra, they stimulate the nipple, and when the nipple is stimulated, it will definitely result in milk secretion. Also, and finally, if after doing all of this you are still experiencing this, then you should know it is time to see your doctor. Do not delay. See your doctor so that the underlying cause of this can actually be looked into and appropriate measures can be taken. And like I said, if you notice that you have any other discharge which is not milky but is yellowish, it is pinkish, or it is browny, then you should know something is wrong, and so you should also see your doctor immediately. So that's it on this channel today. If you've actually gained value, do well to subscribe, also like, comment and share so that more people can see this video and they can learn. So till I see you in my next video, stay healthy, live healthy and be healthy. Ciao.